Employers around the country are operating drug testing within their place of business. We see many mistakes in the drug testing process that can lead to liability, that can lead to lawsuits. In this video, I'm going to talk about the top 5 employer mistakes that we see in their drug testing programs. Joe Riley, President of National Drug Screening. In today's video, I'm going to talk about the top 5 mistakes that I see employers making in their drug testing program. What's important is that eliminating these mistakes will eliminate liabilities, eliminate the potential that you may end up in a court with a lawsuit over the incorrect management of your employer drug testing program. So let's get right into it. The number one mistake that I see employers making in their drug testing program is, number one, they don't have a program. More specifically, they don't have a policy. If you're going to do drug testing, you should have a drug-free workplace policy. The policy spells out the who, what, where, when, and how of the drug testing, and really important, what happens when your employee fails the drug test. So number one on my list is, if you're going to do drug testing, you need to have a written drug-free workplace policy, and it should be distributed to all of your employees. If you're doing drug testing and you don't have a policy, it's time to get one. Number 2 on my list is that you're not using a medical review officer in your drug testing. So proper drug testing should include collection of a specimen by a trained professional specimen collector. The specimen goes to a laboratory for initial screening, and if positive, confirmation testing. Make sure confirmation testing is involved. And then that result goes to an MRO, a medical review officer, who is a licensed physician. And that MRO is quality control. And that MRO deals with prescribed medications that your employees may be taking. Those prescribed medications are confidential. The HR person at the company should not be the person asking questions about prescribed medications that may affect a drug test. That is the job of a medical review officer, an MRO. If you've never heard of an MRO, it's time to find out who the MRO is for your company, and if you don't have one, it's time to get one. The number 3 mistake I see is companies that don't understand or mix up DOT drug testing and non-DOT drug testing. DOT drug testing is drug testing mandated by the United States Department of Transportation. Non-DOT testing is all the other employers that are not regulated by the United States Department of Transportation. These 2 testing programs are different, and they should not be intertwined. There's a specific form for DOT drug testing. It's called the Federal Custody and Control Form. That form should not be used for any non-DOT drug testing. What you have to remember is that DOT drug testing is authorized by the federal government, and it's mandated by the federal government for someone wanting to get a job in a DOT safety-sensitive position. So it's a federal requirement. So you shouldn't use that type of test in a non-DOT testing environment. So understand the difference between DOT drug testing and non-DOT drug testing. Number 4 on my list is kind of new, and it's not handling marijuana issues properly. And I'm talking about medical marijuana, talking about recreational marijuana. Have you addressed medical and recreational marijuana in your drug-free workplace policy? So we go back to number 1 on the list. Do you even have a policy? Are you in a state that has medical marijuana? Are you in a state that has recreational marijuana? The laws among all the different states are different. If you haven't updated your policy with regard to medical marijuana and recreational marijuana, it's time to do so. If the leadership in your company hasn't discussed medical marijuana and recreational marijuana and made decisions about your company policy with regard to marijuana, it's time to do so. So medical marijuana, recreational marijuana are here to stay. They must be addressed in your drug testing program. Number 5 on my list. The person at the company, the person at your company that's in charge of the drug testing program, often called the drug testing program manager, or in the DOT world called the DER, or the designated employer representative, this person must be engaged in the drug and alcohol testing process. This person must be educated. This person must understand your company's drug-free workplace policy. This person must understand the drug testing process. This person may have interaction with the collection site, the laboratory, the medical review officer, or the TPA. The TPA being the third-party administrator, the vendor that you're hiring to manage your drug and alcohol testing. But just because you're hiring a vendor to handle and manage the drug testing program doesn't relieve you from your responsibilities and your liabilities in the program. So as a drug testing program manager or a designated employer representative, a DER, get engaged, get educated. You must understand your company's drug-free workplace policy. You must have HR reps that understand the policy. And the biggest mistake I see, especially today with legal marijuana, is making hasty decisions after a positive test. If you have a positive test, read your policy. Follow your policy consistently. Make sure you're up to date on your state's laws on medical marijuana and recreational marijuana. Make sure your decisions are consistent with those laws. So keep up to date in what's going on. A great place to do that is our website. You can visit www.nationaldrugscreening.com.